Do you ever walk into a room and forget why you came in? Or maybe you lose your words mid-sentence, and for a moment you wonder, is this just normal aging or something more? If you've had that thought even once, you're not alone. We all misplace our keys or forget someone's name from time to time. But dementia is more than that. It's not just about memory slips, it's a gradual shift in how the brain thinks, remembers, and understands the world. It can feel scary, but recognizing the signs early? That's the first step toward hope, clarity, and getting the right support. According to the Alzheimer's Association, over 7 million Americans are currently living with Alzheimer's. And by 2050, this number is projected to rise to nearly 13 million. That's why today's video matters. Because the earlier you recognize the beginning signs of dementia, the better your chances of slowing it down with small lifestyle changes, early treatment, and emotional care. So in this video, we'll go through the top early warning signs of dementia, backed by trusted medical research, and most importantly, what you can do about it. Let's begin. Number 1, memory loss that disrupts daily life. We all forget small things sometimes, like where we left our glasses or the name of a neighbor. That's normal. But when it starts to feel more like missing important dates, asking the same question over and over, or needing notes and reminders just to get through the day, that's different. This kind of memory loss can be really frustrating and scary, especially when it begins to affect your everyday life. It's one of the key early signs of Alzheimer's, and recognizing it early can make a big difference. Number 2, difficulty planning or problem solving. Have you ever suddenly felt confused doing something you've done 1,000 times before, like managing your monthly bills or cooking your favorite meal? It can be really unsettling when tasks that used to feel easy suddenly start to feel overwhelming or confusing. According to experts like Lazak and his colleagues in their neuropsychological assessment, this kind of difficulty is known as executive dysfunction, and it's often one of the early signs of dementia. Number 3, confusion with time or place. If you or someone close to you starts getting lost in places that used to feel familiar, or can't remember what day it is, it can be really scary and confusing for both of you. This might not be just aging. Studies have shown that this kind of spatial disorientation is often an early warning sign of Alzheimer's. Number 4, trouble understanding visual images. A 2020 study in the Alzheimer's Dementia Journal found that when the brain's vision center is affected, it can cause everyday struggles like having trouble reading, misjudging distances while walking, or even not recognizing familiar faces. If you've already checked your eyes and everything seems fine, but things still feel a little off, it might be something deeper going on. This can be really confusing and frustrating, especially when you don't know why it's happening. Number 5, struggling with words in speaking or writing. According to a 2008 review by Taylor Phillips, language decline is common in mild cognitive impairment. If you often lose your train of thought, find yourself repeating the same things, or forget simple words, it could be more than just a senior moment. Number 6, poor judgment or decision-making. A study from USC published in the Journal of Alzheimer's Disease found that early dementia can show up as poor decision-making, like falling for scams, tipping unexpectedly large amounts, or forgetting to take care of yourself. These changes can be really worrying, especially for family and friends who notice them first. And often they appear even before memory loss becomes obvious. Number 7, withdrawal from work or social activities. Do you or someone you love find yourself avoiding family dinners, stopping calls with friends, or feeling overwhelmed by social gatherings? A 2018 study in the Journal of Geriatric Psychiatry found that about 68% of people in the early stages of dementia show signs of social withdrawal. Sometimes it might look like depression, but it could actually be the brain slowly changing in ways that make socializing harder. It's tough for both the person going through it and their loved ones. And here's something important. Research shows that social isolation increases the risk of dementia by 50%. Staying connected isn't just comforting, it's powerful. Number 8, changes in mood or personality. If you or your loved one suddenly starts feeling more anxious, irritable, or suspicious, or just not like themselves, it could be a sign of something called mild behavioral impairment. These mood changes often appear before or alongside memory loss, and they truly deserve your attention. Number 9, loss of sense of smell. Imagine your favorite meal suddenly tastes bland, or you can't smell the fresh flowers in your garden anymore. It might seem small, but losing your sense of smell can be a big red flag for dementia. A 2023 study from the University of Pennsylvania, published in Neurology, found that seniors who noticed a decline in their ability to smell were over 3 times more likely to develop Alzheimer's within 4 years. Why does this happen? The brain's olfactory bulb, the part responsible for processing smells, is one of the first areas affected by dementia. When it starts to shrink, your sense of smell weakens or disappears. This isn't just about missing pleasant scents. Loss of smell can affect appetite, nutrition, and safety, like not smelling smoke or gas leaks. But the biggest danger is that many people ignore it, thinking it's just part of getting older. If you're noticing any of these signs, it's time to act. Here's what to do. Get a medical evaluation. Sometimes symptoms that look like dementia are actually caused by treatable issues like thyroid imbalances, depression, or side effects from medications. These conditions can mimic dementia so closely that it's easy to feel scared or confused. But here's the hopeful part. Many of these causes are reversible with proper treatment. That's why it's so important to check with a doctor early, so you or your loved one can get the right care and support and possibly improve symptoms significantly. Take a cognitive screening test, like the Montreal Cognitive Assessment, MOCA, or the Mini Mental State Exam, MSE, can catch mild cognitive impairment early, before dementia fully develops. These tests are quick and easy tools doctors use to check how well your brain is working. During the test, they might ask you to remember a few words, draw a clock, or solve simple problems. It helps them see if memory, attention, language, or thinking skills are slowing down. Catching these changes early is so important because it gives you and your family a chance to plan ahead. Get support, and try treatments or lifestyle changes that might slow down the decline. Here's the good news. By making some simple, brain-healthy lifestyle changes, you can really make a difference to prevent yourself from dementia. Like, exercise daily, like a simple walk or gentle stretching helps fresh blood reach your brain and keeps it sharp. Keep your mind busy with crossword puzzles, reading the newspaper, or even trying a new hobby can keep your brain strong. Eat a Mediterranean-style diet like lots of fresh veggies, fish rich in omega-3, and olive oil. Studies show this can slow down memory problems as we age. Stay connected, because talking with family or friends every day, even just a phone call, helps keep loneliness and forgetfulness away. Get good sleep because a restful night helps your brain clear out harmful buildup that can cause memory loss. Medications like donepezil or rivastigmine may help manage early symptoms by supporting brain cell communication. These medicines work by helping important chemicals in your brain stay active longer, so your brain cells can talk to each other better. But please, never self-medicate. Always consult your doctor first. Keep a journal because noting behavior changes, big or small, helps your doctor make faster, more accurate decisions. If you want to protect your brain and reduce the risk of dementia, it's really important to cut back on foods that cause inflammation. Research shows that inflammation speeds up brain damage and cognitive decline. Watch out for red meat, especially processed types, desserts, sweets, and sugary drinks, refined grains like white bread and pasta, processed, fried, and fast foods, excessive alcohol. These foods create inflammation that harms your brain's delicate cells over time. It's tough, we know, but small changes can make a big difference for your future. Besides diet, some habits can also speed up cognitive decline. Try to avoid chronic stress, smoking, and a sedentary lifestyle. Sitting too much without exercise or isolating yourself socially can increase your dementia risk. It's not always easy, but keeping your brain and body active and reducing stress as much as possible can really help protect your mind. Here's the truth. Dementia is not the end of the road. Caught early. Many people continue to live meaningful, joyful lives with the right treatment, love, and support. So if this video resonated with you or reminded you of someone you care about, please don't ignore those small signs. Dementia touches millions of families every year, but early awareness, small lifestyle changes, and timely support can truly make a difference. You're not alone in this journey. Talk to your doctor. Ask questions. Take action early. We share simple, researched, and science-backed health info for seniors so you can stay informed, protected, and empowered. Our content is guided by advice from medical experts and doctors, so everything you learn here is trustworthy, practical, and made just for you. That's enough for today. Please like, comment, and subscribe to our channel. Stay informed, stay healthy, and take good care of yourself and your loved ones.